It's time for Wise Money with Korhorn Financial Group with certified financial planners Kevin Korhorn, Mike Bernard, and Josh Gregory.
Welcome to another episode of the Wise Money Show with Korhorn Financial Group, where every week we're helping you take your next wise step in your financial life. Thanks for being here, friends. My name is Mike Bernard. I'm your host. I'm also one of the certified financial planners on the program. And with me in the KFG studios, my business partner and fellow CFP, Josh Gregory, and special guest, Ben Bullgreen.
Medicare is going through some of the biggest changes we've seen in years, and it could impact your financial planning more than you think. Premiums for Medicare supplement and prescription drug plans are expected to rise significantly, and the way you plan for healthcare and retirement may need to shift. We're joined today by health insurance expert Ben Bullgreen to help explain the changes ahead. All that and more on this episode of Wise Money.
Well, now that you got the good news out of the way, we talk about some bad news? Just kidding. Health insurance costs are changing significantly. And what we don't want to be the bearer of that bad news, but we also want you to plan ahead. Both if you're in retirement right now, what do you do? And how do you plan for the changes coming? What are they? But then if you're still planning for retirement, you're not yet there. How does this need to impact your planning? We're helping with that on today's show. If you have a question for the program, we'd love to hear from you. You can call or text us, 574-222-2000. That's 574-222-2000. Online, wisemoneyshow.com is where you can engage with us and leave questions there as well. And then all over social media, wherever you're at, we are there as well. Search The Wise Money Show. Yeah, so whether if you're retired right now, for sure, you need to brace yourself for some changes. Some big changes coming with cost and a little bit of deductible and whatnot coverage stuff we're going to share right now. But also, it's just part of a trend that it seems is occurring with healthcare. And I don't think 2026 is going to be like the end of it. But it impacts you whether you're retired right now or if you're still planning ahead. You have to make sure that you are factoring in Medicare expenses, health insurance expenses in your retirement projection. It's got to be a line item. For many people, most financial advisors or online calculators with retirement, it's just they overlook it. They just gloss over it.
They sure do. And to be honest, I mean, it can be a pretty tricky line item to be budgeting for simply because when have you had to deal with this in the past? You know, if you've worked for an employer who provides some sort of group health insurance for you, the decision's already made for the most part. Maybe you get to make some adjustments during open enrollment each year, but you're not out shopping, really. And so now to be thinking maybe years ahead for a budget item that's going to matter to you a lot.
Yeah.
And on the eve of retirement may be intimidating. These are tough decisions for a lot of people to make. And so it's not too early, no matter what your age is, how close you are to retirement, to begin educating yourself on healthcare in retirement. Man, you talk about an important topic that it's, again, going to get more and more important to you as time goes on.
And I just can't stand where a lot of financial calculators, retirement calculators say, okay, we'll just assume that you need 70% of your pre-retirement income or something like that. No, health insurance expenses for most people, part of it or the majority of it's covered by your employer. So that is a fallacy. Anyway, Ben, welcome to the show.
Glad to be back.
Glad to have you. Ben is one of our health insurance advisors on the KFG team, and he serves hundreds of individuals and families with their health insurance needs, especially right now. We're about to hit open enrollment. We're going to get into some of those basics later on, but we're jumping in the deep end. We're not walking in and wading in. We're jumping in the deep end and talking about the big changes with Medicare. Yep. So, Ben, I know a lot of those are cost changes or whatever, but as we get into those changes, I want to hear from you. But what's the big theme? And then, get into some of the changes.
Well, first off, we can start with maybe the most important question of the show is, do you want to start with the good news or do you want to just get to the news?
Is there good news?
So the good news that I would say for a lot of people potentially is an expansion of who qualifies to contribute to their health savings account if they're covered by Medicare, but also still working.
Okay.
So the rule has been if somebody has enrolled in Medicare, even Part A, the premium-free version of it, and you are still covered by your employer plan, you can no longer contribute to your health savings account.
So here's an example, just real-life scenario. You're still working, and after age 65, and you have a a qualifying high deductible health plan through your employer. And so you're using that and you like it because you're funding your HSA. And at that point, if you're married, you can contribute over 10 grand this year with catch-up contributions and all that sort of stuff. Well, if you automatically got enrolled into Medicare Part A, you didn't even do anything, you were just put on there. In the past, that means you have other coverage, and that makes you ineligible for contributing to and deducting an HSA contribution. Starting right now, that's no longer the case.
And I mean, that burned a lot of people in the past because you could be late in the year, have to go on to Medicare, and maybe you've been contributing to the HSA along the way. Sometimes you have to reverse some of that stuff. So this is a fix to help prevent that surprise from happening for a lot of people then.
Yeah, absolutely.
That's awesome.
That's maybe it for the good
That's
news.
the only good news. Oh my.
All downhill from there.
To me, it seems like, just to set you up, it seems like the theme, while you got into one of the, the unique details of a change, the big theme is costs are going up.
Costs are going up, yeah. And that's for a handful of reasons. That's the very quick summary. A handful of reasons coming into that. COVID has had a lasting impact on healthcare costs in general, because at that point, it was a reduction of who was coming in it was essential services only. And so as the restrictions loosened over a handful of years beyond that, that meant more people are coming in and getting those services done, leading to a strain on some of those insurance carriers, Medicare as a whole. So that's part of it. We're still feeling some of those impacts. In a response to that, we had some changes that happened to prescription coverage. It capped costs for prescriptions for individuals that are covered by Medicare, which is great news for a whole lot of people.
That happened during COVID?
That happened like a couple of years as part of the Inflation Reduction Act is in response to that.
Okay.
So reduction in drug costs, higher or for the consumer, but that means higher costs for the insurers. And I don't know about either of you, but I've never met an insurance company that likes to lose money.
No.
And so that means that, we're expecting some higher premiums on the prescription drug plan side. And with that, higher prescription costs there, higher rising healthcare costs because of some of these delayed procedures. And then the third one is just fraud, waste, and abuse is becoming a bigger problem for Medicare as a whole. So people are getting services done that they don't need to get done, or they're steal somebody's information, bill it to Medicare, and they just get the reimbursements, the payments for them. And so that's leading to some rising healthcare costs as well. Those, I would say, is kind of the trifecta of reasons of why we're experiencing some of these increasing costs over time.
Wow.
I'm glad you mentioned all those, because in my mind, I maybe oversimplify this sometimes, and it does feel like we are still, as a nation, really as an entire world, trying to sort out all of the inflation that happened as a result of COVID and all the money printing and everything. And man, what a painful, clunky step, because we're talking about health insurance premiums going up right now, but we could just as easily, pluck that word out and throw in car insurance or homeowners insurance. Like, these are just jumping at paces that, man, it's tough to adjust the budget with.
Yeah.
So price increase, though, is what we all need to be bracing ourselves for in 2026.
Yes. Okay, so let's break that down. When you get onto Medicare, you're making most likely the biggest health insurance decision of your life at that point, and it's almost irreversible, although we'll talk about a little bit of that. But you're going to decide original Medicare, I call it traditional Medicare, or Medicare Advantage, okay? That original Medicare, traditional Medicare, it's Part A, Part B, Part D, and a supplement, okay? If you go Medicare Advantage, you pay the Part B premium, but then you sign up for a Medicare Advantage or Medicare Part C plan, and there might be another premium that goes along with that. You're picking some drug coverage. Okay. All right. So Medicare Part A, staying no cost for most people. Part B, and this is where we're probably going to need to pick up. We are recording this in advance, so as of right now, the time that it is being aired, I don't believe the Part B rate has been released, but there's a lot of expectation that it's going from $185 per person base rate, this is before IRMA, to $206.50. It started at $205, then I saw $206, now everywhere it's $206.50. That's what everyone's expecting. And you might say, well, okay, that's $26 or $20, something like that, $21. However, that's an 11% increase. When you look at just percentages, that's a big increase. We're also waiting on the cost of living adjustment for Social Security for next year. Expectation is that's going to be around 2.6% for the average person, around a $50 increase. So 40% of your Social Security increase is likely just going to Medicare Part B. We haven't talked about any changes in prescription drug plan costs or part or supplement plan costs. So that's just the start of it. Costs are going up. That's going to impact your planning. We've got more coming up here on the Wise Money Show with Corhorn Financial Group. Hello, YouTube. Thanks for being here. This is the Wise Money Show. What you're watching right now is our weekly 1-hour talk show that airs right here on this channel, 10 a.m. Eastern time every Saturday morning, also on podcasts at the same time, also on a couple local radio stations at the same time as well, which is why the content's broken up the way that it is. Yes, it is a talk show, so it's long form, but we do have breaks and whatnot. That's for the radio station. In addition to this talk show that airs every single Saturday, we've got a lot of other content, other videos that air all throughout the work week right here on this channel, all designed to help you take your next wise step in your financial life. So make sure you hit that subscribe button, turn on notifications so you're made aware every time we drop new content. If you like the content, appreciate that, and leave questions and comments below. Thank you very much. It is so funny to see you in the camera.
You're so small.
You are tiny.
Yeah, my head's in my legs.
I was gonna say you can
Short
move
Ben.
it up a little bit.
I'm okay. I'll just keep it. I mean,
Okay, can you angle the microphone down? Right now it's kind of pointed more towards your nose.
how's that?
I think
A little bit better.
Yeah.
All righty. Well, we'll pick it back up with cost. I'll probably ask you that question that I asked you before we started airing. Okay, if you were to plan ahead, what are those components? It'd probably put you on the spot as well with Part C and yeah. So I think still we're square in the changes. And we're still on the cost changes. Do you have a list of other changes?
So that's in terms of Medicare, when I was looking through the proposed ones, prescription drug, it's the only prescription drug changes would be regarding the orphan drugs, which is the negotiated, that listed 10 prescriptions that are being negotiated on an annual basis for the cost savings that I don't know. Again, it impacts some people, but I don't know. It's not something that I would typically talk with about or to our clients.
And there's not a lot of coverage. I mean, there's obviously a lot of threats and headlines about, coverage changes and cuts coming to Medicare. That hasn't happened yet.
So the couple thing, and come back to the three, I figured we talk about prescriptions, why those premiums are going up, the supplements, why those are going up because there's the rising healthcare costs in general, and then that could be a transition into Medicare Advantage plan, which means also higher costs because sicker populations being covered by the supplement plans, leading to higher costs that way.
Okay.
And then the fraud, waste, and abuse. There is some talk, I mentioned this to you, about some prior authorization being required on some Medicare procedures in certain states.
Yeah. And that's official or that's threatened?
I think it's threatened. I don't believe it's official yet, but.
All right.
Well,
I heard everything that you said. I have no idea the path we'll take, but let's just get into it and find our way. Here we go. Medicare costs are rising, whether you're in retirement or planning for it. It's going to impact you. What do you need to do? What do you need to do? If you're in retirement, what do you need to be doing this open enrollment period? If you're planning for retirement, how does this impact your planning? We're helping with that right now. This is the Wise Money Show with Corhorn Financial Group. Thanks for being here. My name is Mike Bernard. With me in the KFG studios, Josh Gregory, and special guest, health insurance expert Ben Bullgreen. Stay up to date on all Wise Money content. Find us online, wisemoneyshow.com, and then all of our social media, wherever you're at, we are there as well. Search the Wise Money Show. Big changes coming to Medicare, and we're going to talk about this in just a moment, Ben. But when I say big changes, there's lots of headlines and lots of rumors about how, Medicare is broke. It's, you think Social Security is broke. Medicare is in worse shape. Sure. And so there's all sorts of headlines and comments about cuts are coming, coverage changes are coming. And that's mostly been noise. I'm going to put you on the spot and say, well, is any of that true? The big change we're really talking about is costs are going up. Dramatically. So Medicare Part B, likely around a 12% increase. So your base rate for Medicare Part B is likely going to be around $206.50. That's per person. And by the way, if you're on IRMA, that is going to tug it all up, right? Because your IRMA is not going to be based on previous rates. It's going to be an increase on that increase, okay? What are we expecting with increases to prescription drug plans? Do we expect any premium increases there?
Yeah, so the numbers that we had heard last year for this year, so we're talking about the anticipated changes that have come with the Inflation Reduction Act and what will happen to premiums. We heard a 300% increase. Okay?
Oh my goodness.
What?
Now, that hasn't come to pass. And there is some rules in place to prevent those types of increases from happening. The big thing that we have heard as well, to circumvent some of those rules, the smaller percentages, the cap on percentage increases, is plans will just stop offering plans and then offer a new plan that's similar or the same. And then they kind of bypass some of those rules. So no, we didn't see a 300% increase this year. I don't expect we'd see a 300% increase next year, but it is going to be a meaningful increase. So we don't have we're not able to talk about the specific plans quite yet, but we've heard about some $20 increases for some plans that were ordinarily like $10. So 10 to 30, 30 to 50.
Yeah. Nominally, these are manageable, but from a percentage standpoint, outrageous.
Yeah. If that was happening at the grocery store, we would be all freaking out, right?
Yep.
Josh, it has, and we are.
That's all in the past. But so I think the warning, though, that you're giving, if it seems like economically things need a price increase, or they're claiming that a 300% price increase would not be out of the question, it's not doable, so they would have to take it in chunks. But does that lead us to believe that maybe this is a trend that's going to be established, not just hey, 2026 might be a rough year? This could be a series of years?
I would believe so, yes. So it kind of had been corrected where plans were getting less expensive, and then now they're swinging the other direction. So there is always the potential that something else happens and those premiums do come back under control. But from everything that we're seeing, it's not going to be for a while.
Okay, so I didn't ask you if we could go here, but we're going to go there. So in response to this, and premium drug plan costs going up significantly, there's a likely shift coming where these prescription drug plans are going to stop compensating agents or health insurance experts for helping individuals with this.
That's correct.
And so it's very possible that's going to have a significant shift or impact on what health insurance advisors recommend or even how they service. They might say, hey, you're on your own. I'll help you with this other stuff, but you're on your own. Absolutely. Making this enormous decision on your shoulders only when your prescriptions might change, when what's covered might change. I mean, this is an area where it seems like people need a lot of help and guidance. Yeah. And to see this potential shift, likely shift occurring is concerning. And so it could cause a lot of health agents to say, I'm not even going to offer what might be best for someone. I'm only going to offer these things over here. Yep. And we would say, run, don't walk to your certified financial planner's office who's doing comprehensive financial planning, who's working with a health insurance expert to ensure that you're getting the best recommendations and the full review of what's available, right?
Yeah, absolutely. We had a handful of clients who are on a plan that was, let's call it $30 a month for their prescription coverage in 2024. And then they were just automatically renewed into their plan for 2025 at $50 a month. And they would have been better off going with a plan that was $0 a month instead. Wow. For our specific area. So that is, but those $0 plans, there's not a whole lot of margin for those insurance companies to play with talking about commission rates.
Yeah. Yeah.
So that is just another thing to be mindful of. It's not even that agents are talking about it. It's hey, if you're on a plan, that plan is likely going to continue next year, and it's probably going to go up. But there might be some alternatives available that are be a little bit more cost effective for you.
All right. So again, going back to your Medicare choice, traditional Medicare, so A, B, D, and a supplement, or Medicare Advantage. We haven't gotten to Advantage yet, Medicare Part C. Part A, still hopefully no cost. Part B, likely going up around 11, 12%. Part D, prescription drug plan could be going up a nominal amount, $20 or so, but percentage-wise significant. And what about a supplement plan? What are we expecting for increases there?
So what I can say for that is when I would talk with people about, and Medicare Plan G is the most common Medicare supplement. There are 10 letters. There is too many. But we talk about G. And the number that I would use when I was talking with most of our clients would be, it's about $120 a month. I was using that number in January.
Okay.
For somebody just turned in 65, aging in Medicare.
In January of this year.
2025.
Okay.
At this point in the year, I'm using $140, $150.
Yeah.
So we're seeing $20, $30 increases. I've had a handful of our clients come in and say, hey, Ben, I just got a $30 a month increase on my premium. $40 a month, $60 a month we've had. Yeah. So I would expect that to continue. I'd expect that to quicken a little bit because of some of those higher health care costs that we've got, and then also related to the prescription drug coverage. Because as prescription costs go up, and if somebody doesn't have very high prescription costs, actual for prescriptions themselves as opposed to the premium for the plan, they might consider moving to those Part C plans, those Medicare Advantage plans.
Yeah.
And that means they're not paying Medicare supplement premiums anymore.
Yeah.
Yeah.
I ultimately think this could be a big trend that people are shifting more to Medicare Advantage because these costs are rising.
Okay, can we unpack that a little bit? Because, I'm sitting here listening to all these price increases, and you're describing them happening like throughout the year, not just on an annual basis or anything. And, again, to draw a parallel with similar trends that have been happening with, say, homeowners insurance. Man, when someone gets their renewal and their homeowner's insurance has jumped by 15 or 20%, we know it's coming. We're trying to get out in front of that and warn them that it's coming and talk about their options for, is there any adjustment that could be made? Is there any shopping that could be done? That sort of thing. But if we don't reach out to them, they're going to reach out to us. What do people do when their Medicare premiums are jumping? Like what are their options? And you've mentioned shifting to a Medicare Advantage plan. That's like a completely different animal in a way, but what do people do when they see these kinds of increases happening even throughout the year?
Well, coming back to what Mike had said earlier, we treat this like it's a permanent decision. And so if somebody is getting a notice, hey, your Medicare supplement is going up $30 a month in the middle of the year, your option is to keep paying it, cancel it, or you could try to switch to a different Medicare supplement, but you need to pass medical underwriting. You can switch to an Advantage plan, but that's within certain time frames throughout the year, open enrollment being one of them.
Right.
And so you are, in the middle of the year, your options are a little limited. You've got some more every fall to change to a different healthcare solution.
Medicare open enrollment. So this is when you could make that change, October 15, December 7th.
Correct.
So that's coming up. And so I do think these price increases. Okay, so I put you on the spot here. And if you're planning for retirement and you're maybe you're already in retirement, maybe you're not quite there, you have to build in a line item expense for health insurance. It's going to be one of your biggest expenses in retirement. You know that. And if it's not specifically spelled out in your retirement plan and projection, you're under planning or you're getting a false positive, false negative, something like that. And so I'm just going to chalk this all up to around $500 a month. $450, $400 a month or so is what you need to bake in per person for your budget in your retirement plan as you're projecting. We've been doing that with our planning. You've got to make sure that you're doing that as well. We've got more coming up here on the Wise Money Show with Corhorn Financial Group. Shoot, I wanted to talk through that more, but we ran out of time. Okay, well, not that I was had warnings or concerns at the beginning of the show, but this has been good dialogue. So we're now into segment 3 and we're still on segment 1. This doesn't matter.
That's normal.
Yeah, it doesn't matter. Okay, but I don't think we're done. We'll just continue with the conversation and then weave our way over to healthcare.gov at some point, I'm assuming, in this segment. So,
can we come back to that idea of shopping options and everything and just maybe, I don't know, explain that even in more detail, just simply because, I don't know, like if you're getting this bad news, to know what your potential resolutions are. How do I solve this? And I wonder if most people understand, even, just because you have a plan G right now, it doesn't mean you have to stay with the exact same carrier. There could be other options. Maybe in your area, your zip code or whatever, there might be a cheaper solution. You would hope that,
as long as you're healthy enough. So if you can pass the underwriting, yeah.
Okay.
All right, here we go. Can't do math on the radio,
No.
but I'm going to try. No, I'm just kidding. All right. Healthcare costs are on the rise, and that's not just for Medicare. It's also impacting those of you on healthcare.gov, and a big potential tax change coming with the premium tax credit cliff occurring potentially at the end of this year. We're going to share what that is and how you navigate it. This is the Wise Money Show with Korhorn Financial Group. Thanks for being here. My name is Mike Bernard. With me in the KFG studios, Josh Gregory, and then special guest, health insurance expert Ben Bullgreen. Every episode of the Wise Money Show is on podcast. Wherever you listen, just search the Wise Money Show. Rate the program there. Subscribe to it there as well. We appreciate it. That's helpful feedback for us. All right, here we go. This is we're talking through big changes with Medicare. A lot of the changes are premium based. Let me just take a quick tangent, Ben. There have been a lot of discussions about cuts to Medicare, changes to Medicare. Not a lot of those changes just yet, right? I think that's probably, still those aren't like blind threats. I mean, the Medicare system financially is really struggling. And so there likely could be some cuts in the future, but there aren't any big coverage cuts right now, right?
I'd say no cuts. There is a consideration of using more artificial intelligence, AI, to evaluate claims for Medicare as a whole, to try to reduce some of that fraud, waste, and abuse that we're talking about a little bit earlier. So no, not necessarily we're talking about a significant reduction in benefits, but maybe a closer eye on what's being paid out for those benefits.
And then potentially the pre-approval or something like that, right?
Some prior authorization might be testing out in a handful of states. Okay. So and that's on original Medicare. That's something that Medicare Advantage plan, people are used to that because the insurance company needs to approve that a claim is necessary for somebody to get that procedure done. Original Medicare, that's going to be some newer territory, and it's being tested again with the AI, primarily targeted at procedures that have been proven to be ineffective or not necessarily broadly useful for the population.
Interesting.
Yeah.
It all sounds like more red tape and more hoops to jump through in order to get claims paid, to get procedures approved, that sort of thing. So, man, it screams to me that you can't go on autopilot with this stuff. You're going to have to probably play a more and more active role as you get into retirement, just with your own health care in general and dealing with claims. And honestly, that's a big deal. And I don't think a lot of people who haven't reached retirement yet, they're not on Medicare, they don't maybe fully appreciate how easy Medicare has been for a lot of people. Mike, you and I have probably heard all kinds of retirees over the years just say, man, my Medicare and Medicare supplement, my prescription drug plan, that layering of coverage that I have in retirement, it's the best coverage I've ever had. It's so easy. And it sounds like maybe that might be changing here with just procedurally some of the changes that could be coming. Yeah,
and I think that is in response to some of these higher costs. They're trying to introduce some measures to reduce that by at least a little bit.
All right. So for your budgeting, if you're in retirement and you're on Medicare and you're trying to budget for next year, or if you're planning ahead for Medicare or for retirement, I've already said you've got to bake this into your planning. Traditional Medicare, Part B, $206.50. A prescription drug plan, don't really know. Could be $25, could be $30, something like that. Throw that in that budget. And then a supplement, Plan G, $150. I mean, doing the math there, that's what you should budget for, and that's per person. And that's why IRMA is definitely something that you need to be planning ahead for and trying to avoid. with some careful proactive tax planning, because surcharges on top of that make it, go from feeling awful to feeling punitive.
Yeah. Well, you said in an earlier segment that you would recommend budgeting about $500 per month per person for your retirement plan. Would you recommend changing anything with the inflation rate that you assume on that?
Without question. And Josh, I know you're setting me up because we've always had this at KFG. We've always, when we've done our retirement planning, that retirement forecasting, we have assumed, there's five factors, right? Spending, what you're going to spend in retirement, that's the second one. We've argued about this. One of the most important. They're all very important. And you've got your base expenses, you've got loans, you've got taxes. Health insurance needs to be a separate piece. And part of the reason why that's a separate piece is so that you can have a different inflation rate applied to that component compared to everything else. Right. We have always applied a 5% average compound inflation increase to that healthcare expenses. Looking back, just Medicare Part B over the past decade, it's averaged about 6%. Mm-hmm. So I would say at 5%, we're in the hunt. If you weren't even planning for it, or if it was just part of your normal expenses and you were assuming 2% inflation, 2.5%, 3%, you've way underestimated. You have to have this separate in your retirement planning, and it has to be at a higher inflation rate. I would still use 5%, even though we've seen an average of 6%, and next year is likely going to be higher.
Yeah. But the point is, you can't leave it out of the budget. You have to inflate it at a faster pace than just normal expenses. We would typically inflate your lifestyle today at about 3% per year, compounding over time, so that by the time you get out to retirement, we have a better guesstimate as to what you'll actually be spending out there in the future. But yeah, this Medicare and all the healthcare expenses related to your retirement spending, they have to go at a faster pace. They have to be inflated at a faster pace just to be able to leave room in the budget out there in the future. That puts more demands on what you need to have saved and accumulated for retirement, though. And you might say, well, man, that's just making this burden out there in the future. Who can possibly save up for that? That's kind of the point.
Yeah.
That you have to be aggressive in your saving and in your investing for the future, because the needs are going to be great out there in the future.
Okay, so that just leads us back to, how does this apply to you? What do you need to do? If you're in retirement, you're on Medicare, make sure you're talking with your agent. Make sure that your health insurance expert is collaborating with your certified financial planner at KFG. We've got a full team of financial planners. We also have a health insurance team. They collaborate together. We work together. So that's what you need to explore. Well, do you shift plans? Do you consider Medicare Advantage? I do think a lot of people might be looking at those more. And then if you're planning ahead, we've talked about that. Mm-hmm. So let's talk about that potential shift to Medicare Advantage. Are we likely to see premium increases for Medicare Advantage plans?
Yes, but not nearly as high. So we're talking about most of the Advantage plans have a $0 premium. Again, you're still paying that Part B premium of about $206 next year. But most of them have been $0 a month. We're talking like $5, $10 a month, maybe, for what 2026 premiums will look like. So a much smaller increase, still close to zero. What we're probably going to end up seeing is higher max out-of-pockets, some higher costs for hospital stays, higher co-pays, that kind of stuff to help offset the higher costs that they're facing too. But they try to listen to consumers and what's important to consumers, well, that $0 premium.
Yeah. Okay, so what's the profile of someone that would, because I'm thinking that's going to sound very appealing to the discussion we've had compared to the discussion we've had so far.
Absolutely.
So someone that says, I'm going to make this shift. I want to make this shift. What's the type of person where you'd say, yeah, maybe it would be a good fit for you, or the type of person where you'd say, I would not switch.
Yeah.
Don't do that.
Well, one thing before we even get into that, Medicare Advantage plans do have a 1-year trial period. So we're talking about if you switch from a supplement to a different supplement, you would need to pass medical underwriting. If you have never been on an Advantage plan before, you could switch to an Advantage plan for 365 days and switch back to the supplement you had previously without passing underwriting. So just a kick the tires.
Yeah, they give you a trial run.
A little trial run. So anybody within that 1-year trial period, just to get an idea of how it would work for you. But in general, individuals who maybe go to the doctor once a year for an annual checkup. Somebody that prefers more natural treatments, they avoid going to the doctor as much as possible. Somebody that has access to a pretty robust hospital network. So rural county, maybe not the best option because you might have to drive a little bit farther to get to the doctors that you want to see. Whereas in the Medicare supplement, as long as the doctor bills Medicare, you can go and see them. So we're talking about networks of doctors, somebody where dental, vision, hearing, some of those additional benefits are really important to the consumer. I typically say, well, that's the cherry on top because we're making a medical decision. Yeah. But for some people, it's just that is their highest medical expense for a year. So they want to offset some of that by a little bit.
Have you seen any kind of trends in more and more doctors just choosing to not even accept Medicare? Like they're just not going to treat that entire population because they don't want to deal with the bureaucracy and the red tape and everything?
A little bit of an increase. It's still not a ton.
Okay.
So it's kind of an interesting business decision to not work with Medicare at all.
Yeah, right.
The big theme is you got to be planning ahead for this. You've got to have the right team. Who's your guide? Who's guiding you? And are they taking the right approach? A comprehensive financial planning approach, looking at all of your options and seeing what fits best for you and your financial life. We've got more coming up here on the Wise Money Show with Korhorn Financial Group. All right. Fourth segment. Okay, let's shift over to healthcare.gov. And we might popcorn in Medicare. I mean, we've talked about open enrollment a little bit. So I think we're probably okay. So healthcare.gov, the ACA cliff, planning for it. So ways to reduce your AGI or modified adjusted gross income, those sorts of things. And then if we weave back into Medicare, that's okay. But yeah, we'll open it up there. Here we go. Thanks for being here. This is the Wise Money Show with Korhorn Financial Group. My name is Mike Bernard. With me in the KFG studios, Josh Gregory, and special guest Ben Bulgreen. Every episode of the Wise Money Show is on the Wise Money YouTube channel. Go to YouTube, search the Wise Money Show, check it out, subscribe to the channel, and then turn on notifications so you're aware every time we drop new content, because it's not just this talk show that's on the YouTube channel every week. We've got next Wise Step videos, typically one for every single business day of the week, all with content designed to help you take your next wise step in your financial life from a comprehensive financial planning perspective. Not siloing, not in a vacuum, not with competing priorities, how you merge it all together. The 6 areas of your financial life, my financial life, everyone's financial life need to be fused together to make great decisions. So go to YouTube, search the Wise Money Show, subscribe to it there. All right, Ben, shifting the gears a little bit to Medicare, but unfortunately the same theme, and that is healthcare costs just naturally are just going up.
Yep.
All right. One of the things that I think is still in debate at the time we're recording, hasn't been solved yet. I think it'd be a Hail Mary if it is solved.
Yeah.
And that is individuals that are on healthcare.gov, getting their insurance through healthcare.gov, could see not only just a premium increase, which we can talk about, what percentage you're bracing people for, but also a change in some of the tax benefits. This is known as the ACA cliff. Explain what that means.
So there was a cliff previously, and that was if somebody earned, if a household had earned above 400% of the federal poverty level, they would not qualify for any tax credits whatsoever.
By getting their health, only when you're getting your health insurance through healthcare.gov.
Yes, correct.
Yeah.
So if you got a 1 penny over that, you would not qualify for anything. A handful of years ago, it turned from a cliff into a slope. So it was a gradual taper off of who would qualify for the tax credits in an effort to make health insurance more affordable for more people.
And that was part of COVID and everything. So ACA, if you're a history buff, I think that was passed in 2010 and all the drama surrounding it, blah, blah, blah. And of course, all the drama because of the fiscal, the expense and all that sort of stuff, the administration of this. And yet at the same time, like this is a crucial stopgap for coverage if you're planning to retire before 65 or if you're going to start your own business. I mean, this is an option for health insurance for a lot of people,
Yep.
So
that slope was extended until the end of this year, 2025, and the cliff is returning in 2026. And so as of right now, as if somebody were to earn above 400% of the federal poverty level, they would no longer qualify for any tax credits.
And the way those advanced premium tax credits work often is you're making a guesstimate at the beginning of the year what you think your income's going to be and what you'll qualify for, right? But you don't really know because there's a true up that happens on your actual tax return. That's when, the rubber meets the road and it all is no longer theoretical, it's actual. And boy, I'm remembering back to the original Cliff type days. And the risk here is you think your income's going to be at one level, and then you have some surprise income that comes in. Maybe these are wonderful things. Your business does better than you think. You get a pay raise or a big bonus. Maybe you inherit something that has to be cashed out, and it all drives your income up. And like you said, if you just creep over by even just one extra dollar above that 400% point, you all of the premiums, or all the credits rather, go away.
Gone.
And you may have already received them. You're essentially paying them back at that point on your tax return. And man, I'm still traumatized. I remember one client who she had some surprise income. None of us saw it coming. It was a wonderful blessing, but it put her all of a sudden in a situation where she had to pay back all of these credits, and it was thousands of dollars. We were able to circumvent a lot of that by doing some careful planning after the fact. We had her tax returns done. We started doing some contributions to some retirement accounts to bring her income down, and we were able to get her back down below that level. So the tears, thankfully, were premature. But my goodness, you talk about a surprise. You hear the word Cliff anywhere related to the tax code, and you should be nervous.
No offense to any of you out there named Cliff. But there's planning. There's proactive planning that you can do, not only in the year to make sure that you're contributing to getting as many above the line deduction. I'm struggling for the right jargon-free word here, but contributions to IRA, HSA, 401k, deferring income, that sort of thing, where you can keep your modified adjusted gross income low so that you don't get even a dollar over that limit and trigger, a repayment of all these tax credits. The other thing, knowing this right now, if you are thinking cash flow wise, I'm going to need to draw out a certain amount next year, or I know I want to sell this investment or whatever, and it's going to have a capital gain, consider doing that in 2025 so that it doesn't land on 2026 and potentially disrupt this.
You're talking about like maybe drawing some money out of an IRA rather than do it on a monthly basis out there in 2026. What if you did it early?
I mean, you've got to be aware of the trade-offs. This is why you can't just make these decisions in a vacuum. You've got to work with your CFP, looking at all 6 areas of your financial life, but think multi-year.
Exactly. I was going to say the same thing. This is a great example of why you would want to be doing tax projections, not just looking at the current year, but even forecasting out into the coming year.
So Medicare open enrollment is coming up, or just open enrollment, October 15 through December 7th. Those on healthcare.gov, is that the same window where you want to log into healthcare.gov and see if you should make any plan changes?
Very similar, November 1st to December 15th.
Okay.
So a little bit of a shift. But yeah, they will be available. And we talked about trying to brace.
Yeah, I was going to ask you, so go ahead.
So we've heard increases of between 20 and 70%. Now, I said 300% earlier, so maybe we just hear people that are, on that very high end of thing. I think it's going to be closer to the 20% increase, and the 70%, they were maybe talking about the felt increase when we're talking about fewer people qualifying for these tax credits. Is, well, I was used to getting $500 a month off my premium, but now I have to pay that back. So those together, I think, is maybe where we're seeing some of those, the higher costs.
Yeah, so all that to say, I mean, this trend and change of higher healthcare costs is not, I mean, employers are not immune to it. So if you've got group coverage, you're not going to be able to avoid that. Healthcare.gov, it's impacting that. Medicare as well. All of this impacts your planning. Yeah. So if you are on Medicare or on healthcare.gov, I've said before, like proactive tax planning, I would say everyone needs it, But if you are getting your health insurance through healthcare.gov, it is not a luxury. It is a necessity. You have to proactively plan, and you have to make sure that your health insurance advisor is working with and collaborating with your financial planner. It's non-negotiable.
Yep.
There are thousands of dollars at stake in these decisions.
And they touch so many areas of your financial life, right? We're talking about cash flow. We're talking about the insurance protection decisions that you're making. Yes, the tax code is alive and well and having an impact here. It may have an impact on how you draw out of your investment accounts from year to year, as you were just saying, Mike. And clearly, this is a retirement decision, either on the eve of retirement to bridge the gap from going, off of a group plan and eventually reaching Medicare. We were talking all about Medicare in the first 3 segments as well. And so you think about just one decision that you're going to make. Healthcare in retirement or healthcare on the eve of retirement, it's touching all areas of your financial plan. That's why you need a certified financial planner that has a team of experts collaborating with them all on your behalf.
Yeah. So open enrollment starts October 15, Ben. You and the team about to get very busy. This is your tax season coming up. But we've said multiple times that those on healthcare.gov or on Medicare need to sit down and review coverage. And we've got a more streamlined process for that this year as well. I mean, that collaboration and the communication and the planning, because even healthcare.gov, you and the team help people kind of sift through what their options are and help navigate what plan would be most appropriate.
Absolutely.
Yeah. And we even saw some of the changes. This was coming into 2025. I think this is a trend, though, where high deductible plans might be dropping the HSA eligibility. And especially with the return of the ACA cliff, I would make sure, if you're going to go with a high deductible plan, make sure it's HSA eligible. That's one of the levers you can keep your modified adjusted gross income down. So, Ben, always appreciate you being on the show. I know it wasn't great news to talk about today. You're not the one making those decisions. You're the one helping people through it. So appreciate that. All right, that's all the time we have for today. On behalf of Josh Gregory, Ben Bowgreen, all of us at Korhorn Financial Group, have a great weekend. We'll see you next Saturday for the Wise Money Show with Korhorn Financial Group.
Securities offered through Silver Oak Securities, member FINRA/SIPC. Advisory services offered through KFG Wealth Management, LLC. Doing business as Korhorn Financial Group. KFG Wealth Management, LLC and Silver Oak Securities Incorporated companies are unaffiliated.